to first start off with congratulating you for being a finalist on the code launch in Atlanta.
Thank
And
you.
I wanted to ask how that went because it seems like it was a pretty big deal.
Yeah, it's pretty big deal. It's not over yet. So we made it to the finals. I'm pitching on this coming Wednesday,
Oh, okay.
August 18th. So starting this Sunday, there's a 2-day hackathon. So Sunday and Monday we're partnering with a local development shop called Improving Atlanta. So it's a big firm that has a branch here in Atlanta. So we're partnering with 5 of their developers for a 12-hour day, Sunday and Monday, and then a few other things. And then Wednesday, 5 p.m. I'll be pitching. So to see if we can win this thing.
Yeah, you should remember to
Yeah,
smile, right?
that's right. My wife keeps telling me that.
And for those that don't know, Code Launch is kind of this it's like a software startup expo, so to speak. So it's like a seed accelerator for some of these for software companies, right?
Yeah, that's correct. So the whole thing is to help companies that on the verge of bringing a product out in the market, like an MVP, minimum viable product, and just put them on stage for them to get exposure, but at the same time, then making sure that any through the partnership that they have with other development firms, technology firms to help those startups. So I think we started around maybe a good 100 different startups who applied, went to the quarterfinals, down to I believe like 30, and then to the semifinals, down to 18, and then finals, final four.
It's amazing. It's great.
Yeah. So we're excited. We're excited. It's just like I'm rehearsing my pitch like I'm running and I'm thinking about the pitch. I'm sleeping. It feels like I'm thinking about the pitch. I'm like, make
It's always
sure
about the pitch.
make sure you remember your name.
Remember the name of the company and remember your name. Those are the
Yeah,
most important
remember your
parts,
name.
right?
That is correct. That is correct. So, but we're excited. Excited of this opportunity, and so, and any folks out there who are building a company, it's like you'll take whatever opportunity comes at you, and I think this one was just came out of the blue, and we jumped on it, and it seems like great things going to come out of it. So.
Yeah, for sure. And before we are going to definitely get into your company and exactly what it is and what like the motivation and why behind your company is. But
Sure.
I wanted to get into a little bit of your history because one of the most fascinating things I saw like in your career is that you have a PhD in mechanical engineering, and
Yeah.
your story kind of started off in engineering and you ended up in healthcare. And what was your curiosity with getting a PhD in mechanical engineering?
Oh yeah, I like that question. As a child, growing up in Haiti, that's where I'm from. If you're trying to guess where the accent is, I always tell people, hey, Southern accent, definitely Southern, right? You get that's south of Florida,
Oh, south of
you
Florida.
get, that's right, you get Haiti. So it's really started for me. It's a weird way. It started in my passion was like healthcare, right? I always wanted to be a surgeon, and growing up, and I think being from Haiti, seeing everything on a daily basis, people seeking care, right, seeking or don't have access to the right level of care, and so always wanted to be a surgeon, and then I got into high school in Haiti, then started studying anatomy, didn't like it, and then I realized, if it's not healthcare, if I don't like anatomy, I don't think I'll be a great surgeon. So I move into, it's like, well, what else do I like, right? So I like math, and I have an analytical brain. So math, and then, engineer, in Haiti, they have many options in terms of career. So engineer was the next one. Got the opportunity to come to the state, was in Miami, then Georgia Tech to finish my undergrad. And I think, as an immigrant, you're always, trying to be the best at everything that you do. When you come to this country and you see the opportunities that the opportunities that there are, right? She was like, oh my God, there's so many, right? And to me, like PhD was always like someone with a gray beard. Well, now I'm gray, but right. So I'm like, oh my God, this is so far. And then when I got to tech studying, I was very good. And then I'm like, oh, it's like, why not? At the same time, too, I was an international student. Money was hard, right, to get, and you were not allowed scholarships even if you had the grade. So grad school, the way they were putting it in front of me is like, hey, grad school will pay you and you get a degree. So I'm like, this is a great deal. I've been paying my undergrad,
Right.
right? A lot of money. And then now they're offering me free education and money on top of it, stipend as well.
Right.
So, decided for my master to stay for my master's, and then decided to stay for my PhD. I was like a sucker for punishment. And and then yeah, no, it was very interesting. And then but at the end I was like, hey, I was like, I got tired of writing codes in my lab and running things and simulations. And I'm like, I need to talk to people. And then I got into consulting about 15 years ago. And health and I guess I was trying to find my way back to my first passion, which is healthcare. So 3 years of IT consulting. That took me to South America for a year in Montevideo, Uruguay. Then came back here doing some work at AT&T as a consultant for a company called Amdocs. And then 2 years of that switched to Deloitte Consulting. Then out of the blue, my career counselor called me, with my kind of the mentor, right? Your career mentor at Deloitte, and my career counselor at Deloitte. And she's like, hey, I have a project here in Atlanta, Piedmont Hospital. We just need you for a week. Show up, right? You're just going to be putting some information called preference card into Excel. I'm like, okay, sure. And so did that for a week. Second week, they're like, yeah, you can stay, right? We just need a body. So I'm like, yeah, sure.
I'm a body. Yeah, this works.
Yeah, my body, right? I mean, although my boss, who's still a good friend of mine, as a mentor to me, Mary Jane, she was like, oh my God, I'm so embarrassed. I have a PhD doing data entry, but I did the best data entry, and I did a good job apparently. But then my mind started, spinning, and I'm like, we have a bunch of information that we need to put into, what they call Eticon cards, 5.25 cards, to Excel, because they were prepping for Epic implementation a bit like a year or 2 years down the line. So we're just getting them ready. And so I was like, okay, well, how much time is taking me by service line, like ortho, cardiothoracic, general surgery type procedures? How long is it take per cards, right? And figure out the math on how many people we need if we need to meet that deadline. So she was impressed by this small little calculation. So she's like, "Hey, bring some junior folks," and so I did the next 3 days, for like 3 days, 2 days later, and then we spent about 5 weeks doing 5-6 weeks doing data entry. And then my boss came and trying to give us a pep talk, how great this work is. It was like really mind numbing. And then the folks I was working with, we had a structure. I mean, I put in a structure, target, and everything like that. So they heard her and just like, okay, that's great, but we need to get back to our work because we have a target, right? And so she's like, oh my God, I came in to give you a pep talk. I got shooed out of the room, right? What are you feeding those people, right? And so that was me. That was my introduction, or the beginning of my career, if you will, in healthcare. She's like, oh my God, I need someone like you why don't you come to North Carolina, and to work with the team, right? Doing something else, not data entry this time. And then did that. Then they're like, oh my God, you're so good. Let's go to California. Let's go to St. Joe's system. And it, from a week became like over a year. And then I'm like, oh, this is, healthcare, it's interesting. That was my first love. And I can see with my analytical mind, right, the good or things I can add value to a lot of processes, to a lot of things that, and as an engineer, like, okay, this needs to make sense. And how should they connect to make sense? And so I saw an opportunity for me to make an impact. And that's how I stayed into the healthcare space. And for now it's been like 12 years now. And about 2 years ago, decided to branch out, but still making an impact, but more directly impact to helping caregivers, family members that are caring for a loved one, affected by dementia is one of the things that we're focusing on for now, but we're looking beyond that. Overall, it's like any condition, but you gotta start somewhere. Healthcare is massive.
Yeah, it's huge. And one huge issue, and I like that you're, getting into healthcare and trying to like innovate it, because I feel like healthcare is so outdated in so many different ways. It's
Yeah.
insane. I mean, from documentation to, I mean, everything. There's just more processes that need to get better, and so more people who are engineering definitely. And data analysis is huge now.
Yeah.
And not only just analyzing the data, but interpreting it, right? It's one thing to collect all the data and be like, here it is. And then there's another thing to be like, okay, this is what this actually means. So I think there's interesting fields emerging within the healthcare community from people who are in engineering or data analysts or mathematics and so on and so forth. So it's
very much so. I do agree. And that's the realization I had, like, over a decade ago. It's like, that in this industry, the healthcare industry is lagging, has been lagging compared to other, if you compare it, right, to financial industry, what you can do with your smartphone. I mean, when is the last time you really, really had to go to the bank? Right?
Yeah,
right?
Yeah, I don't remember the last time I went to
I
the bank.
remember the last time, right? You can do everything now on your mobile, right? And you have the confidence that what you're seeing is accurate, right? But look at the healthcare space, right? You go to the doctor's office, you don't know how much you're gonna be paying after a procedure. It's just a surprise all the time. It's like you get
Here's your bill.
Here's your bill. I mean, you don't even get the bill at the doctor's office. You get it through the mail. And
Right.
sometimes after 2 weeks, 3 weeks, they're like, surprise.
Like, oh, remember that procedure that you got that was minor? Yeah, it's gonna be $5,000.
That's right, right? Oh, we thought it was gonna be covered by the insurance. Hey, the insurance only cover a portion of it. Sorry, you're gonna have to pay the rest.
Good luck.
Right?
Yeah.
Good luck. And it's really the only industry, right, when you think about it, that you're getting a service and you don't know what you're paying for. Right?
Every time, yeah.
Every time.
There is a couple. Someone actually told me about this. There's a company, I think, in Oklahoma, and they're like a cardio or like a heart health clinic, and they have like a menu. Like literally, if you go to a restaurant and they say, this is exactly how much this is going to cost, this is exactly how much this is going to cost. I was like, that is the first time I have ever heard somebody doing that. And I was like, maybe that's what we need to do more.
No, for sure. Price transparencies. A procedure like a hip replacement can cost, depending if you're in the LA or, Milwaukee or somewhere, the price can vary, from a $20,000 procedure to a 15,000 to a 10,000 to a 50,000. So it can be all over the map, right? Of course, there are factors that justify some of it, right? But again, the lack of price transparency is definitely, not helping.
No. And I want to get back into your company, and this is Evva Health. And so your motivation behind getting into this space kind of was, it stumbled upon you. You kind of started getting into healthcare. It was where you wanted to become a doctor, but I guess, was there another reason to start to get into healthcare, or at least start Evva Health? Because starting a startup is not easy. It's not like, oh, I'm going to wake up and do a startup today. And so when in your mind did you decide, like, this is what I'm going to do and this is why?
Yeah, I mean, it's I'm getting older. My parents, I are getting older, and unfortunately, like last June, I lost my dad, right? And so, being able to care for your loved ones always, with my dad when he was going through his different chronic conditions, being able to help and support. My sister was the primary care provider. Just the fact that my dad was in Haiti, away from me in Atlanta. So it was, as a son, it was very difficult to actively participate in the care of that loved one. And yeah, of course you can send money, but sometimes you want to be, you want to be, hey, what can I do beyond just sending money to help. And sometimes very difficult to ask. Well, my sister, she's a medical doctor, so she's accustomed to hearing folks asking and asking how they can help all the time. But at the same time, I'm the older brother, so I want to, you get that sense. You want to protect everybody. You want to protect your sister, your little sister, and so it stemmed from that, and from the professional experience as well, right? So seeing, being the system, looking at the healthcare, the provider system, seeing some of the inefficiencies, and realizing, when you leave the provider's office, right, the doctor's office, the hospital where you are, there's very little help or support that's available. You know, I'll take that back, right? Support can be available, but do you know where to find it, right? So, you leave the hospital, you leave the doctor's office, they give you instruction, and then you're on your own, right? You have to figure out who in the community where you are can help you, right? Where, yeah, you can have some recommendation, doctors can give you a flyer and just check these folks out. But, depending on what you're dealing with as a caregiver or as a patient yourself, right? There could be a stigma or shame associated with your condition,
Mm.
right? That's the case of dementia. That's the case for lung cancer, right? The lung cancer, right? It's a terrible cancer, and when you talk about folks who have it, or I'll give my example. I sit on the board of the American Lung Association here in Georgia, and trying to raise money, and I've talked to a few folks, and a lot of them are like, well, it's those smokers, right? Those folks who, it's like, well, it's too bad they got it, but they kind of asking for it. And I'm like, that's not true, right? You have a lot of folks who have never smoked a day in their life, and they contracted the disease, right?
Mm.
So there's stigma associated with some of these conditions. And so trying to get help, right, makes it even more difficult, right? The shame that you have, and be like, okay, can I ask for it? And the stigma that associated is, if I'm asking for this, right? If someone is mentally impaired, right? I'll, it's like, it needs to be hidden, right? You don't know. And I've talked, through Evva, talked to a lot of folks, and when they know what we're working on, that's when they open up. And folks that I've known for a few years, they're like, oh my God, my dad is going through that right now. I'm like, oh my God, I've known you for a couple of years. Never mentioned that.
Yeah, it is weird that we kind of put it off into a corner, almost like this, or in like in a closet, and we're like, we don't want to talk about that, or it's something that people are ashamed to talk about, and it can certainly wear on somebody. I mean, for you, what was your experience? I mean, being away from your family had to be tough, but what was your experience like? Maybe when you first knew that your dad started experiencing symptoms with dementia, and to the very end, kind of thing.
Yeah. So my dad, had other conditions, right? So he didn't have dementia. He didn't have dementia. So
Oh,
just
okay.
wanted to be clear. Although sometimes we joked about him being that, right? But never diagnosed. It was never diagnosed, so I can't say for certain.
Sure.
Right. So, to me, I think, it's the inability and sometimes the helplessness, or figure out, who do I know, who in my network I can contact to help with certain things. And sometimes you don't, it's like, my sister say, hey, I took that to Dr. A, send a bunch of tests. Well, now you're gonna have to email it to me to see what was the result and have some conference call to talk about what happened, right? She's busy, running a hospital, and sure she also has her life. She has two boys, I have two nephews, right? So it's trouble. It's that helplessness, right? And figure out. I mean, you the will is there to help, but not being. But you're seeing sometimes you're spinning your will, and that can be frustrating, right? And I'll give an example of my uncle passed away recently as well. So I mean, it's been terrible this year for us.
I'm so sorry.
Yeah, aunt and I have an aunt who passed away. Was my godmother, and my uncle in Florida. So this one was because of COVID. You were not allowed to see folks at the hospital.
Right.
Right, even my aunt, his wife, couldn't see her husband at the hospital, and I was trying to decipher from her what was wrong. Right, they were moving him from hospice to emergency room, so I'm like, can you tell me what's wrong? I can make some phone calls, I can reach out to folks and trying to get some help for you, but she couldn't, relay the information. So I'm like, tell me, right? So she's like, they're talking to me. I mean, of course, there was a language barrier as well with her, not between the two of us, but between the provider and her.
Mm-hmm.
And she couldn't relay what exactly he was saying. So I was kind of trying to decipher, and that's for sure. Of course, you cannot force her, or I mean, she can. I mean, she was distraught with everything that was happening and trying to get information. It was just like impossible.
Yeah.
So there again, that sense of helplessness. And so how do we empower folks, caregivers, right? Primary caregivers, secondary caregivers, with the right information at the right time to make the right decision.
Yeah, and you see this a lot in dementia. I mean,
Yeah.
when you get that primary diagnosis of that, there's often just so much that kind of follows suit with it. And depending on how fast that happens, you're like, okay, I think usually the first thing that people think of, like, how am I gonna afford this, or how am I gonna do this? And so, Evva Health is working with people with or family members with dementia. How are they mitigating some of these issues that caregivers typically see?
Yeah, so thank you for this. So as we're looking at, our focus, our startup is really the support for caregivers, for family caregivers, and I'll say again, family caregivers. So people like you and I, right, that are we're caring for a loved one. When we first started talking about caregivers, they're like, oh, professional caregivers you're talking about, right?
Right.
Yes, they're part of the ecosystem. They need to be part of the ecosystem as well, same as providers, right? Same as community members. When we're talking about just regular folks caring for their loved one, right? And so when we look at the problem itself, right, we see first piece that is that provider interaction. You only have like 8 to 15 minutes to deal with the doctors, right? Whether you got the doctor's office or emergency room, right? You're being given a lot of information that you have to decipher, right? That you have to figure out. And imagine if you're caring for someone, an aging person, someone with dementia, they'll tend to have more than one chronic condition. So dementia is not the only condition or set of symptoms that they're experiencing, right? They can have high blood pressure, being diabetic, and things like that. So you're dealing with multiple doctors, right? That you have to figure out what they're telling you and break out the information into action items, right? So which can be overwhelming. And on a daily basis, you're coordinating the care, dealing with folks, whether it's your pharmacist trying to renew prescriptions, folks that come in to support if you have that ability, or if you're able to hire folks, or family members trying to help, providers doctors are still sharing some information with you. So that's overwhelming. So that daily care also is overwhelming. From a self-care perspective, right, you tend to forget about yourself, right? And If you're single, I guess you can really just focusing on your loved one, on your mom, your dad, or even your spouse, if if you're in that age, right? But if you have a family, right? If you have young children, you still have to care for them, and a lot of time you as the person, right, take the back seat. You forget about yourself, right? So how do you provide the best care to someone if you're also struggling? Right?
Mm.
So that's the third component. A fourth one is it's planning, right? Planning is necessary for, especially for someone with dementia, which is an evolving, right? You start from early stage to mid stage to late stage dementia, and that's an evolving, disease, if you will, right? Or your symptoms will start deteriorating. So you have to be aware and and recognize all these things. So you have to plan for the future. And so when you are in that reactive mode all the time, it's just hard to plan, right?
Yeah.
Right. And if you're, if you fail to plan, you're planning to fail, right? And so where we come in, the difference with Evva is, we start that conversation. We start right after you see what after your clinical visit, right? We take that information, that care plan, right? We capture it and break it down into action item for you, so you can have it right on your phone, and to figure out what you need to do on a daily basis, on a weekly basis, right? Whether it's an appointment, whether it's exercise, whether it's a functional status test that you have to do to keep the provider informed of what he or she needs to do, or to modify the care plan, right? So the third piece around kind of self-care and support. So it's not just about technology, but how do you bring in that human touch, right? That human component. How do you bring in your community, the folks in your community that can support you? Whether it can be a neighbor, right, who have that experience. It can be community organization, right? That maybe that are there and can support you, right? I'm thinking Meals on Wheels here in Atlanta that goes to certain areas in the city to support, right? To provide food, but also, hey, guess what? If something is amiss, right? They can record that information, right? And funnel it, and we can have funnel that information to the appropriate, whether it's a provider. In some of the case, working with them, they were telling me, they're like, hey, sometimes we see a rep that's broken, where we reach out to Habitat for Humanity, right?
Mm.
See if they can come in and help, right? So for us, is that community element, that's important. And also gave, when you think about the community, right? Depending on where you are, your needs will be different, right? So I want to make sure that you're not getting recommendation from someone who doesn't understand how you live, right? Where
Right.
you live, right? What do you have access to? You can say to folks, hey, guess what? You need to change your diet. That's great, right? But if if I'm in a certain part of the city or the state, or right, do I, you know, can I have access to vegetables, right? Uh, or I mean, even I may not have the money, right, to buy those things.
Right.
But is there organization in my community that maybe can help facilitate, right, or address the needs that I have? So it's beyond just, oh, you need to do this, but hey, here are the folks that can help you do this, right? Whether it's a service provider, whether it's someone in the community that can coach, that can help, right? So we are creating that ecosystem, right? That's really really centered around that caregiver and family, right? Bringing, the providers, of course, right? Creating that super highway, but also, bringing the community into the mix. And for us, the community is not an afterthought. It has to be an integral part of our ecosystem. And so that's Evva.
Yeah, and community is huge because
Yeah.
you're you're describing the story where we're kind of going over a lot of broad topics very quickly, but when you have other things going on in your life and you have a family member either older or like you said a spouse who has dementia, you can very much feel alone. And so having that sense of community and having other people go through the same thing, or perhaps somebody that's like already gone through it once before, can be
Sure.
enormous in helping you out. And
Mhm.
so How do you determine like what steps are next for each patient? Because not every like you said, certain stages of dementia
Mhm.
happen very fast, and so how do you tailor it towards the individual patient of like, okay, this is probably what you need next, or this can be helpful in this instance?
Yeah, that's a good question, and that's the thing that we're actively working on, right? And that's where the AI, AI when you say AI, right, artificial intelligence, comes into play, right? How do you create a personalized experience,
Right.
right? Where do we start? I mean, a lot of it starts from the care plan on what the doctors recommend for you as a well, care plan, I guess. What you need to what you need to do, or what are some of the instruction and guidelines, for you to what you need to follow in order to improve or maintain, right? So that starts with this, right? But also we have identified kind of 25 different, including social determinant as well, right? That how do you, based from that information, how do you include those factors, right, to really to make it personalized, right? For example, like, so if you are with African American in Georgia, we know we are big church goers, right? We like to go to a church. Faith is a big part, and also for me in the Caribbean, that's also a big component. And a lot of times, folks look to their faith leaders, right, to for information and for guidance, right? These folks needs to be involved, right, and working for them to be also involved as well, right? So it's not just sharing. So it's also who's sharing that information, um, and you see it with COVID-19, right? So folks in certain communities of colors, minorities are still scared, right? I'm vaccinated, but I've talked to folks and they're like, well, I'm not ready for this, right? I don't want to be an experiment.
Right.
So they're still there. So some of the non-traditional players that sometimes companies often dismiss, right, needs to be part, right? And we're definitely aware and working towards including those different organizations. And so I know it's a long-winded answer, but everything starts with the care plan, looking at where they live, social determinant of health, right? Their background, their access, and figure out how do you as you make that care plan or a reality for a family that's in a penthouse in New York, in Atlanta, versus someone who's struggling on a daily basis and struggling to keep his or her car running.
Yeah. What are some of the pain points with like a diagnosis of dementia? I mean, obviously, I think education is a large part of it, of like what's actually going on, like how long is this going to take and so forth, but also financial. And maybe there's some other pain points that I'm not aware of. So I guess as you've developed the company and as you've started to analyze data about what needs to be done for these individual patients and their care plan, what are some pain points that are you're running into for these patients?
Yeah, say, information, like you mentioned, it's a big thing, right? Really understand the disease and make sure that the people around you understand the disease, right, that you have, right? So, when I think about, dementia, like dementia, right? Dementia is a set of symptoms, right? Of not being able to perform activities, your daily activities properly, memory, thinking, all those element gets deteriorates over time, right? And you see folks are when you talk about dementia, they all say Alzheimer's, right? Alzheimer's is a type of dementia. Alzheimer's is actually the disease that causes those that have if you have this disease, you experience those symptoms, right? Alzheimer's, of course, is the largest, is the most people, 60 to 70% of people who experience dementia symptoms are diagnosed with Alzheimer's, but there are the type of dementia, or other type of dementia, right? Different diseases, just to be correct, because I've read, wherever you go, it's like, okay, when, it's like, okay, Alzheimer's disease, then I get vascular dementia. So it shouldn't be vascular disease or something that causes. So even the nomenclature, it's a bit confusing.
Right.
So you have, I think it's about 11 different type of dementia in quotation, or things that fall under the category of dementia. Alzheimer's is the biggest one. You have frontotemporal dementia, vascular dementia, Lewy body disease, Parkinson causes dementia as well, and there are a few ones, a few other ones. I think they're very small. I don't even remember their names, the extra names. So information first, is just like really understand what the person or the loved one is experiencing, and also there is discrimination in the system, in the healthcare system, right? So the latest Alzheimer report or fact sheet on dementia, shows like 50% of African American experience some type of discrimination, right? Seeking help, for someone with, so for their family members, who have dementia, right? I think Latinos or Latinx, it's like 40%. No, Native Americans about 40%, about 36% for Asian, and around the same number for Latinx. So not only information is scarce, but also there's discrimination. When you think about the provider themselves, right? When you think about geriatrician, right, there should be kind of the front door and supporting those, be the reference point, right, for information, to where to find information. That number is very small. There's not enough geriatrician in the country, right, to support the folks who are experiencing dementia. So that's a very small number. You go to your primary care provider, but not all primary care provider can really diagnose effectively whether or not you have dementia, or support you in that process, right? So there's, right there's an issue. And of course, there's some great work that folks are doing throughout the nation. Right here, Emory is doing some great work with their dementia, their integrated dementia clinic, or integrated memory care clinic, they call it, IMCC, in the community here in Atlanta. But of course, right now the reach is limited to just in the city. I know they're working hard to expand that. So the support, for families is limited. There's that stigma based on race. Also, the planning piece, when you think about, there's a lot of decision that you have to make as a family, as a primary caregivers, that for that person as well. When do you stop? When do you stop? When you take away their driving license? From a financial, that's an expensive disease to have. It's very expensive, right? So planning has to be number one. So where do you find the folks that can give you the right advice around financial, around legal, right? So remember, your loved one may be there physically, but they're losing, their cognitive function. So when is the time that you need to make that decision to take away things from them, so to protect them? But you still have a person that's leaving, so there is that interaction that sometimes could be very difficult. So how do you educate those, not only information about the disease itself, but also how do you educate those primary caregivers to react better and to expect a few things that's going to happen, right? Someone asking you, and I know one of our advisors, his wife has mid-stage dementia, and she's asking him on a daily basis, is it Sunday yet, right? He understands where everything is coming from, but sometimes he loses his patient and maybe raise his voice, and someone who has that disease, you're raising their voice, they're becoming paranoid because they feel like that you're hiding things from them, right? So it's like, and you're not, right? But they think, right? You're like, it's like, or you don't care for them as much. So there is, so there's a lot of pain points. So for me, I think about when I think about that, caregiving, the friction, it happens from a interaction with your provider, interaction with different service provider in your community, friction between your loved ones, right? That who wants to make decision, and fighting what needs to be done to better care for that person. Planning, finding the right folks in the community that can support you to make the right decision from a financial perspective, from a legal perspective as well.
Now, as part of that, also helping the provider, like I can, we started talking about kind of that like losing patience thing, and I can imagine psychologically it can be a lot on caregivers. And so, are there steps with your company to help perhaps get help with what they need and finding other people that are going through the same thing so they can at least relate to them and have a sense of community?
Yes, so that's definitely right. You don't want to be alone in this, right? So
Right.
creating, what we're working on is to be able to find folks in their own community so that they can bond with, right? So it's also, I mean, I keep saying provider, like they are the bad guy. No, they're not, right? They're doing the best that they can. And I think we're also, how do we help them as well? How do we enhance the experience that they're trying to, or elevate, right, the care of their patient, right? So it wouldn't be nice to, the same care plan that you're providing, but we're just taking that same information and converting in bite size that they can easily follow, that your patient can easily follow. So they don't have to call you like in the middle of the night or send you a text or go to the ER, worse, right? Go to the ER to ask the questions that could have been addressed if the information was given in a bite-sized fashion, right? That's money saved, right? You're talking about reimbursement,
Right.
right? You have that person coming back within 30 days and then you're getting penalized as a provider. So we are supporting the provider as well. So, it's to us is patient, family, provider, and community, right? So we're not trying to say anybody's a bad guy, but how do we work together? How do we elevate, right, the care experience for these families by working together?
Yeah, it's working on all those points, and
Yeah.
building a community is a central theme that brings everything kind of together, which is great. And that's how I think you guys are going to stand out and hopefully end up winning this code launch thing, because I think it's what you guys are doing is fantastic. But for financial options, what are there things that are available to like maybe the state? Are there other maybe financial things that people aren't aware of if you're a provider for somebody who has dementia that they can access?
Yeah, it's so Medicare or Medicare, sometimes Medicaid, provides some, there's some help there, but it's not long term, right? So you're not going to be, a year, 2 years in an assisted living facility or something with using Medicare and Medicaid. Well, sometimes it's states by state dependent, right? So it's, there are folks that's what they do on a daily basis, right? Figure out, hey, what are some of government help, and there are some out there, but again, state by state, that can help you. What are some organization in your community, like, that can support, right? So if I'm thinking of like, if you are in the middle of the city of Atlanta and you don't have access to decent food, right? Meals on Wheels could be a solution for you, right? But that's different if you're in rural Georgia, right? So our plan, so it's really finding those folks for you, right? And bring it so you don't have to go and do that search. Like, okay, where do I find those people? But based on your needs, say, I have a dietary restriction. I'm in the middle of city of Atlanta, right? I don't have money to go to Whole Foods, to Publix, right? To Kroger. Hey, is there an organization that can help me? Hey, let us do that for you, right? And bring those folks to your door and support you.
And we talked about comorbidities earlier,
Yeah.
and comorbidities are just other diseases that can coincide with dementia. I
Yeah.
guess, and you had mentioned you're on the American Lung Association for Georgia. What are some other comorbidities that are often associated with dementia, and do they lead to dementia, or are they just a typical part of the diagnosis with dementia? Do you have to have one without the other? Or can you have both? Or I guess describe the role with comorbidities.
Oh, that's a good one. Well, when we started this 2 years ago, it's like, okay, you have dementia and you have dementia, and that's all, right? And it's not the case unless you're the lucky 8% who probably only have dementia as a disease that they're fighting, or set of symptoms they're struggling through. You're going to have more than one, you have one or more comorbidities,
Mm.
right? um, I, I think I can still the graph in my head. I think about 30% or 30-40%. I'm a numbers guy, so if you can tell.
Yeah.
30-40% of folks have two or more, right? Of two or more uh, condition comorbidities, beyond, of course, additional to dementia. So, the jury's still out on, what are the what's causing, right, this, right? It's not the normal process of aging, right? Is your brain chemistry, biology is changing. And so, like for African American, when you think about, like, hypertension, talking about any vascular diseases can cause. But again, I don't want to use that. I don't want people to quote me and say, "Oh yeah, if you have high blood pressure, I do have high blood pressure." You'll be a candidate to, you're going to have dementia at some point. No, it's not. It's not this. So I don't want to comment and say exactly what are you. Is there a connection per se? I think the jury is still out on this.
Mm.
But when you look at an African American community, we know we have, high blood pressure, diabetic. So those are conditions you can have whether or not you have dementia, right? So when you see that segment of population, you start saying, oh my, okay, they have dementia, but also they are dealing with, high blood pressure. They are dealing with, they are diabetic, right? They have other cardiovascular diseases that they are struggling with.
Yeah, and part of what I'm assuming Ava Health is going to do is work with that as well. It's not just going to be like, okay, you got to get the medication for dementia, but it's also managing blood pressure and managing other doctors as well.
Yes, no, that's exactly right. So
Okay.
you're going to have multiple. So there's going to be that, medication reconciliation type piece. And so one thing when folks like, okay, you're focusing on dementia, I'm like, yeah, well, our focus is that for now. I mean, the ocean, if you think about the ocean, is vast, right? And if you say about, all condition, that's vast, right? They all add their subtlety, the way you care of folks. But um, but you got to start somewhere, right? For
Absolutely.
us, when we think about the caregivers, when we're thinking about a caregiver with dementia patient, you tend to have more than one person because it's just so draining on one person, right? You think about that readmission rate for providers is twice as much. It's twice as much compared to someone who doesn't have a dementia diagnostic. And so, it's like, hey, there's a big need there, right? So went after the dementia, the dementia piece, try to make an impact, right? But dementia itself, like the statistic I just gave about comorbidities, folks will have other conditions. So they'll be taking medication, they'll be having care plan just to manage those specific conditions, right? So you are forced, whether you like it or not, you are forced to help the family. If you want to really, really make an impact, you're forced to help the family address these different conditions, or at least manage, right? The care activities to mitigate, to address some of these some of the pain points that they have, because they have those comorbidities as well.
Of course. And from the beginning, you've been working with Eva and building this startup company for over 2 years now. And so I guess, how has the direction of it changed? You mentioned earlier that, earlier on we just said, oh, it's just dementia. But like, you're like, oh no, this is like, there's a lot going on here. And so I guess, how has the direction changed from the beginning of when you started Eva to now?
Yeah. So, as as we're thinking, as we're focusing, so as we're focusing on that family caregivers, right? So we're making it a bit, a bit broader, broad, right? In a sense where, dementia is, our system we're building is a bit, disease agnostic, if you will, but with features, that will help, folks that have, dementia, features by the type of information. So we're building a library, right? So the library has, of course, has a lot of dementia information reference, right? But it has to be a library that accommodate for other chronic conditions as well, or comorbidities, if you will, right? So we're expanding a bit more, right? So it makes sense for a family using this, because they're going to be looking for more than information, for dementia information. They'll be looking for other help, right? And that's how community for us, always at the forefront. In our roadmap was a bit further down the line, because again, we saw we can tackle everything, but we moved that up front, right? Because while dementia is an issue, the communities are also important. And of course, how do we bring the community to so the technology is not just a just piece of technology. How do we from the get-go empower the community to start supporting
How do you build it
versus
like a brand, right? Like you want people to be like, that's where I go to, help my mom or help my dad or help my,
that, that
my
that's that
spouse.
that's exactly right. A center of excellence, a center of excellence for caregiving. So if I'm caring for someone, right, I want to go to Evva, right? I want to use the Evva app to find, because I'll know I'll get the support that I need, and the tools that I need, right, to manage things on a daily basis, to get the right reminder, right, on medication, on activities that I need to do, but also, hey, to find the right support for what I'm dealing with,
Right.
right support for the loved one, but right support for myself as well.
Now that you're managing various roles with Eva, and you've noticed that, there's so many different comorbidities and it's multifactorial. How have
Yeah.
you stayed on the main objective? Like, okay, we need to make sure we're building the community, and we want to make sure that this is the resource where people go to get help. Because
Mhm.
along the way, you can definitely steer course to be like, go down this rabbit hole of like, okay, maybe we should focus more on, the financial aspect things, or maybe we should focus on, just having people get help in the regards of like managing their medication. And so how did you prioritize like just building the community first and then going forward into what it is right now?
Yeah. So it's a juggling act, right? So I think you always, things are in the air, right? You always juggle, right? So we always, figure out, okay, what's important, what can get us to that next level, right? Because it's also, you're trying to be attractive to investors as well, right? To be able to build a company.
Right.
So it's not just, yes, of course, your primary objective is the family, it's the caregivers, but in order to make that product reality for them, you also have to think about, the investors, right? What's makes sense, right? And how can you position yourself to be, generating revenue, so you can build those AI engine and make serious impact, right? So there's definitely that juggling act that we do on it, almost like it feels like on a daily basis.
Right. For sure.
Right? That we have to do, and take a feel the pulse of, where you are, what part of the states you are, what investors are thinking about, what are some of the potential partners you have, right? What are the interest, what are their interest, right, in what you're doing, what could resonate better with them as well, right? So it's not definitely not a straight line, right? It's sometimes, you're gonna have to, take a side, go sideways a bit to get back to the main objective.
Mm.
um, but our vision, a vision at the end. So I think we like to look at the future. I mean, what we want, our big vision is to be able to create that ecosystem and bring it at the neighborhood level, at anywhere in the States and beyond, right? Whether in an affluent neighborhood or a struggling neighborhood, you need to have access. You want to have access to the best possible care and to the best possible folks in your community. And so, as we're thinking about our business model as well, right? We're working to price it at a price of a latte. At least starts at the price of a latte, $6. And so someone who's struggling can afford it. And we're also thinking about ways to have that even $6 make it free, right? To have other folks, whether it's a managed care plan, whether it's a life science company, could sponsor some of these content. And so you having access like information. So are you having access to our platform and to the tools? It's free for you. So we're working towards, this is kind of that vision. So it's you're not preclude or push aside because, oh, guess what, I can't afford $6 or more, right?
Is the vision like just an app-based platform where you can go on and kind of just find everything that you need, or is this going to be a website? I guess, what was your guys' vision with this?
Yeah, so it's definitely both a web and an app, right? Folks are always on their phone, right? So app is going to be first, and of course, depending on who's working or thinking about that platform, it's definitely it's a platform that we're building, right? Is from a provider perspective or from a service, right? From a service provider beyond the doctor, you may not want to necessarily interact with, if you have a lot of folks that you're helping in your community, to interact on your phone per se, right? So we're working on that, and there's quite a bit of advancement in the technology fields where you can program at the same time on two multiple environment.
Yeah. And do you think that the age thing is going to be a barrier to entry for people who maybe are older, who have like maybe a spouse, maybe they're in their 70s, is like, I don't know what I'm doing here?
Yeah, so that's all those things too that we have to think about. So we've been thinking about. So how do you make something that's easy to follow, right? That you can just like it's intuitive, easy to follow. It's not overwhelming. At the same time, it's not boring, right? It's like I feel like some when you're looking at some of the apps targeted towards folks that are a bit older, it tends to be a bit boring. You're like, okay, this is it's like this is very rudimentary, very simple and boring. Why? And folks are asking why can't it be like a commercial looking app, right? Why? Because I'm 70. That has to be just a couple of squares.
Right. Yeah, it's got to be simple, right?
It has to be simple, but it's that's part of that's all those questions that we ask ourselves. We're pondering and figure out what's how that solution look like. How does it evolve as well, right? So it's not just doing it once and done, right? But how do you capture the needs of the folks in the community that they are in, and see what's more relevant to them as well.
And how are you? This is it's such a personal brand, right? Like this is something that your family members are going to use, and this is how it's like, I need to get my dad or my family member like better. And so how important has it been to hiring the right people to make sure that you guys are going in the right direction? Because sometimes some people just like want to work at a job just to get paid,
Yeah.
And so, with the company that you're working on, I can imagine hiring the right person is going to be super important. And so how have you managed to delegate or at least find the right people to help bring your goal of Evva Health into fruition?
Mm-hmm. Well, it is, I think every startup struggles with that, right? Especially when it's so personal,
Right.
to find the people that align with the mission or vision, right? And but surprisingly enough, last year when we put a word out, we're looking for interns, and 2020, things were not where nothing was happening, and so we put a word out, it's like, hey, you know what? Let's just get. I mean, we unpaid internship, right? So it's an unpaid. We'll put the word out and see what we get, right? Maybe we'll get one person, and that would be great, right? We'll
Yeah,
get one
right.
person working remote. We'll do something. We end up with 12 folks.
Wow.
12 folks, and from all over. I mean, we had four from Georgia State here in Atlanta. We had, I think, another four from University of Michigan, California Institute of Design. We had another one was based in Seattle, and from masters and undergrad. So it was, and at some point I was like, those guys know that it's unpaid internship. I mean, they were like so passionate about it. I'm like, you're not, I can't afford to pay you yet, right?
Right.
Like we made that clear. Hopefully, we made that clear, right?
Right.
So
Yeah. Like, you know what you sign up for, right?
we're gonna sign up for. But I mean, those guys, we're still in touch with them. These guys were, I mean, giving it their all, and they all were aligned with the mission, right, of what we're trying to do. So I know, of course, it's a hard thing, but it definitely are people out there that recognize or understand the vision and wants to support it. I think anybody, when you think about, we're all getting old, our parents are getting old, right?
Right.
um, for some of us, we'll be, we'll be parents or and things like that. So, you want to have something or solution to help your loved one. You'll be called to support, right? So my mom is getting older, right? So we're thinking about us just split her time between Haiti and the US, right? So it's like, she's my mom, and I want to take care of her too, right? So I'm telling my sister, I cannot have her for herself now. She's gotta come and hang out too.
Right. Exactly. Well, and the other,
She's actually here. She's visiting.
oh,
She'll
that's
be
great.
here. Yeah, she's here. I think she'll be. I already bought her ticket for that event, for Code Launch on 18. So she'll be in the podium in the audience.
Good. Now you definitely have to smile. Now you can't, you're going to
I
be told on both
know,
fronts.
I know, I know, I know. I don't know if that's gonna make me nervous. I don't know.
It'll be your good luck charm for sure.
That's right. That's right. I'll be looking for her.
Right. And being a leader, you worked in this data analyst kind of job when you first started, and now you have this startup company, and now you got employees, and you're doing this code launch thing. One thing that I've noticed is that you have to be able to communicate effectively how you want things to be done, or you want to communicate exactly what your mission is and your why behind your company. And I
Mhm.
guess how have you become a better communicator from the time that you started Eva Health to now?
Oh well, I think it's been I think it's a work in progress. Always working on it, right? I think from being an introvert engineer
Hmm.
to a consultant, so that was definitely kind of the next level. You have to talk to people.
Yeah.
You have to talk to people, right? I think that's why I went to consulting. I mean, I was like, I don't want to be very what I call two-dimensional. I want to have that people dimension, that third dimension to me, right? So that's how I went 15 years ago. I went into consulting, and so I changed from that, right? I'm still an introvert, right? I still need time to recharge.
Sure.
Um, so as I think you're always learning, you're always adapting, always I mean, to me, I think I'm good at reading the room, or have kind of that EQ. I definitely, not to toot my horn, but I do feel, I do know that I'm, very, although I'm numbers guys can be very black and white at times, but I still, do my best to relate to folks, to understand their drive, because sometimes you can see someone taking an action, and for you, it's like, okay, why he or she's doing that, and having a conversation with that person, understand, what's, there's something could be a miss, something they don't understand, or something going on personally that may be affecting their decision making, right? So I think being, for me, it's like always being, trying to be connected with the folks. A bit hard to do when, especially when we're doing a lot of things remote. So a bit, I think that's although, being able to connect across distance is great. So we're having this conversation, loving it. But sometimes, meeting that person, being in that same room, you get a lot more information. And I think being an introvert, I'm like always reading, right?
Mm-hmm.
Body language and things like that, right? And so I think I miss part of it, right? So it's more challenging, especially if the other person is not, it's not, doesn't want to open up or anything.
Yeah, certainly. And I think being in person is so much, you pick up on the little things. And I think starting in engineering, I kind of do something similar where you pick on like the little things, little cues, and it all kind of gets integrated into like how you approach somebody or talk to somebody. And
Right.
it's always this constant analyzing, and
I
considering you do it
know.
for your work, I'm sure it's like 20 times over in your
Oh my
head.
God, yeah. Oh my God. So I think that's why, introvert, we need to recharge,
Hmm.
right? At times you need to be away from people. You need to, even if it's an hour, right?
Right. Yep.
Go run. I go and, and run just to be away because, yeah, I always, you're always in any situation, you are not analyzing things, right? You're looking for everything besides, listening to what the person is telling you, but you're also looking for those subtle, twitch of the body. Does that mean something?
Right.
Right. And
And
it
then you go
can,
down that rabbit hole of like, what does that mean? Was that something new? I've seen that before. What is that? What does that
it's,
mean?
that's right. That's
Right.
right.
And so now that you're in this healthcare space, you work with the American Lung Association. You have this startup for dementia. How have you tried to, I guess, stand out as a healthcare leader? And I saw that you're also doing a mentoring role or try to be a healthcare mentor. And I guess maybe describe a little bit about that and like who else you're maybe helping to try and improve healthcare with.
Yeah. So I've done a couple of things in that, in that field. So this summer I was part of the YLA program, which is a Department of State program. It stands for Young Leaders in. They're gonna kill me if I mess up. I'm gonna mess up the acronym.
Right.
I got the first two letters.
Yeah.
But the program, let me give you a description of the program. So the program is to pair, mentors or business leaders in the U.S. to folks in Latin America and also the Caribbean,
Mm.
right? So this summer was partnered with my mentee was young gentleman. It still is. We still kept the conversation. I'll tell you a bit more. So young gentleman out of Uruguay. Seems like I'm going back, right? Out of Uruguay, Daniel, right? And is building building a company, as is building a company that's in somewhat in the healthcare field, but it's a cannabis, company,
Oh,
right?
okay.
I
Hmm.
guess medicinal marijuana.
Hmm.
But he wanted we got connected to help him think about strategy, right? And so we did. We also put out, work together on a grant. We just won a grant to continue that conversation and continue, the effort between the two of us and trying to get his company to the next level,
That's
right?
great.
Also about 2 years, no, like 2016, I spent a month, a pro bono project in Accra, in Ghana,
Hmm.
and helping a healthcare organization, a NGO, non-government organization. Healthcare is a healthcare organization that's really about empowering women and helping them become entrepreneur, to be kind of the, beacon or the health, um, resource, if you will, within their villages, right? So a health keepers network out of Accra, Ghana, and so did a month pro bono. Got invited back 2018 to. No, that was a funny one because I had invited back to shoot a mini documentary.
Oh, really?
Yeah, to show to I mean to give to talk about the experience and things like that. So that was an interesting experience. So I'm always open, right, to help, right, because I've also been helped, right, coming to this country and things like that. So I'm fueled. I'm always happy to support, right, to support folks beyond organization and things like that, but support folks who are looking for a mentor and looking for someone who's done maybe more than they have and looking to can leverage my help to get them to the next level.
Yeah, and I definitely want to highlight that because not all the time you have people who are doing startups who also just dive so deep into living and breathing helping healthcare. And I think I wanted to highlight all the accolades that you do because I think it's great and that your background is stemming in this, and again you did that pro bono. So I mean it's fantastic work, and I want people to understand the man, or at least the person behind this company, because I think it's going to be something that people are going to really benefit from, and understanding who runs it. I think it can be like, wow, this is something where I can really get behind and help and
Mhm.
support in a great way.
Yeah, right. We're people at the end of the day, right? We do we become our best when we're supported,
Mm.
right? And to me, it's that's important to me. And if I can make a difference to other folks, right? Might say, hey, I've seen you on a podcast, you know, uh, can we spend 10, 15 minutes, 20 minutes having a chat, right? And that happens on LinkedIn with me all the time.
Hmm.
And it's like, yeah, sure, right? So I'm happy. And I was talking to this lady in out of Portugal,
Mm.
right? Who's creating a startup, and yeah, so we had a good conversation. Another lady from the West Coast. So it's people can find me on LinkedIn. I'm always open, right? Obviously, not all the time I can be, oh yeah, I can meet you right now, right?
Right.
Day, right? So, but I do believe, right? I do believe in the power of. I still believe in the human in us as human, right? And the good that we can do when we come together, right? And how sometimes just a little push, a little advice can really change your life, right? And if someone can make that difference for me, and I can make that difference to others, that's great. And folks have made a difference for me, by talking to them, by them encouraging me, right? And so if I can do that for others, I'm always super excited.
Yeah, we need to do that more. We definitely need to believe in humans more, and believe in humanity, because there's not a lot of that as much going on anymore. So
No, unfortunately, right? There's still, of course, some folks are still doing good, or are working hard to do good things, but unfortunately, what's being reported is always the bad, right? It's
hmm.
the bad. So you end up, if you just look at the news, you end up thinking that's all happening. Everything is bad, right? So the good sometimes the good, I guess sometimes could be boring. I mean, not to us, but maybe to the news that doesn't sell. So if everything is like, oh, those people had a great day.
Right. It's just not as polarizing, right? It doesn't get you like, oh
Yeah.
well, he got really angry. What happened next?
What
It's
happened? Yeah, he
yeah,
was
yeah,
super
yeah.
happy. It's like
Right.
he's
You're
like
like, all right,
super happy.
sweet.
I think I'll be the worst one if I get on a reality TV show. It would be so boring. Like this guy is always smiling. Yeah, nothing really pays him too much. He
No, I
goes
think
on
it'd be great. I
run.
think it'd be great if anyone's listening who can do a good documentary, hook them up with this new show going on for this company. Well, I know you're a busy man, so I want to kind of conclude with our last questions here, just to
Sure.
kind of highlight who you are as a person. And this is the Health Me closing questions. And
Oh,
you had a little bit of time to look at the questions. And so the first question I want to ask you is, if you had the attention of everyone in the world for 30 seconds, what would you say?
oh, 30 seconds.
30 seconds.
Oh man. I'll say there are many things I want to say, but I'll say, believe in the power of community, right? Don't forget about the community. Don't forget where you're from, right? What people who helped you, right? They are in your community. Rely on them, and that's all.
Like, love it. I think it was less than 30 seconds, so it's perfect.
Okay.
You're traveled all over the world, and you've lived in the US for a while now. I have to ask, which is the better coast, east or west?
Oh man. Man. Ah, wow, 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 wow. Man, I mean, I'll say, oh no. Both coasts are great. I'll do both the sign, West Coast, the East Coast, right? So I'm all, I'm playing both coasts.
Paying both coasts? Oh, come on. But if gun to head, you're like, all right, east or west coast, what would you say?
So what? Oh my God. Oh man.
You're like, listen, you have one opportunity, Carl. You got to live on the East Coast or you got to live on the West Coast for the next 25 years of your life. Where are you going?
Well, I say the West Coast. I love the West Coast, right? Great weather, perfect, right? Uh, East Coast is closer to family,
Mm,
right? So it's a tough one, right? It's a tough one.
it's a tough question.
It's a tough question, and it's like, yeah, I mean, I love the state of California. I think it's a great state. I mean, you get everything. I've traveled the state quite a bit, from LA, Apple Valley, in the desert, to San Fran,
Right.
right? So I've crisscrossed that state several times over. Love the state. I mean, love you can go to the beach and go skiing at the same time, right? East Coast is closer to the Caribbean. It's
It's a tough question.
it's a tough question. I mean, you can't do that to me, man. You
All
cannot do that.
right. I'd say, I think your answer is if your family was on the West Coast, you'd go to the West Coast.
That's right. I'll
Yeah.
be
Yeah,
throwing
yeah.
gangs on. I'll be like
All
going West Coast.
right. All right. Final question. How do more people find out about who you are and what you do so people can get in contact with you? I'm going to provide links and stuff to everything in the show notes, but I want to hear from you if people want to get in contact with you. Please.
Yeah, please reach out to me on LinkedIn. I'm there all the time, right? So it's called Hanna. Send me a message. So send me a friend request, right? And so I'm more than happy to connect. Send me a message, right? Send me a message. I'm happy to, whenever possible, jump on a 15-minute call. If you want to talk about my experience here, right, in the States, as as an engineer, as someone of color, if you want to talk about Evva, of course, that's always in my mind. So I'm more than happy to chat and have a conversation, have a human connection, right? So always open to that.
Carl, thank you so much for coming on the podcast. I really appreciate
Thank,
it.
thank you, Mike. Take care.